Okay, welcome back everyone for another episode of MedChat Monday Healthcare Specialty Series. This healthcare podcast is geared to educating you about all the healthcare specialties that are out there and really giving you the nitty-gritty about which particular specialty you should pursue. Today we're going to dive into what it's like to be a pediatrician. That means taking care of little kids. Today we have Dr. Unachukwu, who's on the show, who's a pediatrician. It's going to be really interesting. She loves what she does, and she's going to give us insight. So welcome to the show.
Thank you. Thank you so much for having me. And you can call me Dr. Una.
Okay, that'll be a little easier for me.
A little easier for you, yes.
So Dr. Una, tell us a little bit about your background. I know you have an interesting background. Where did you go to medical school? And I always like to start the interview with, why did you become a doctor?
So I went to medical school in the University of Nigeria. So that's a West African country. And they go based off of the European system. So it is 6 years of medical school right out of high school. Toughest thing I ever did, because it is survival of the fittest. So we'll put 400 people into medical school, let the best 120 win. And that's really how it works. But it was a really great experience. I come from a place where my parents are like, you can choose whatever you would like to do, as long as it's a professional course. So these are your options: medical school, law school, accounting, and architecture. I think that was it. So medicine won. But my parents, my dad is a surgeon. My mom is a clinical pharmacist, so it kind of rubbed off, I think.
Okay, so you had to decide very early on when you were young that you wanted to go into medicine, because there was no such thing as undergraduate degree. It was medicine right from high school.
Yes.
So when you started, did you know that you were going to pursue ultimately a career in pediatrics?
Well, if I could tell the truth, it's a really funny story.
Please tell the truth. That's why we're here.
And they're like, so what do you want to be? What do you want to do after med school? I'm like, I don't know, but I do know I don't want to be a pediatrician. So, but the group of people I felt the most compassion towards was the women. So initially I was going to be an OBGYN. Then kind of saw the schedule and the lifestyle. I was like, yeah, I have too many other things going on. The 24-hour on-call forever is not going to work for me. So I was like, where can I still work with the women? And then pediatrics became the obvious choice. But I absolutely love, I don't even know why I said I didn't want to be a pediatrician. I absolutely love what I do.
Okay, so you knew you wanted to interact with women, and yes, the closest thing to OBGYN for you was pediatrics.
Correct. Because it's very overwhelming to be a parent, right? You haven't been a parent before. Even if you haven't been a parent to this particular kid, and they don't talk. They just cry, whether they're hungry, whether they're sick, whether it doesn't, so it can be overwhelming. So I love having the opportunity to partner with moms, new parents and all of that to take care of their kids. So I kind of get two for the price of one.
Could you take us through those early years of medical school? I'm assuming in your first few years in Nigeria, you had didactics, where you were learning about the anatomy, physiology, all the general classes.
Yeah.
When did you say to yourself, I'm going to do pediatrics? Was it a rotation that you got exposed to?
It was after a number of rotations, but truthfully, I don't know. I didn't have one of those aha moments like, this is the time and this is what I'm going to do. It's something that kind of happens slowly over time. So, do the first rotation, then do another rotation in another subspecialty and come back and kind of ended up there. There was because for some people, they're not going to have an aha moment. And sometimes they feel, well, something's wrong with me because I didn't have this clear time when I knew I was going to do this. And everybody doesn't have that. I don't know that I had that. It was just a decision that just kept going stronger and stronger as I went through rotation.
Did you have a mentor?
I did. I had a number of mentors. Medical school is tough. I don't think anybody should do without a mentor. Some of them, I had a few. Two of them were in pediatrics, so maybe that swayed my decision some. But two of them were OBGYNs as well.
So what do you love about pediatrics? Because not everyone loves pediatrics. One of the reasons that I hear commonly is that they don't know exactly what the kid is saying, or if the kid's in pain, or what exactly is going on. So I'm curious, and I'm sure the people listening are going to be curious as well if they're pursuing a career in pediatrics. What do you love about pediatrics?
Well, so first things first is I love solving a problem that a lot of parents have, which is I don't really know what to do with this itty bitty kid that I have. It's a big issue. I can't tell you how many times parents come into my room, into my office, they're in tears. Like I can't tell if I'm breaking my kid or whatever. So that's a big problem, and I like having the privilege of solving it. I like, seeing a kid 14 years later, and mom is like, oh my goodness, I don't know how I would have survived without you at that time. So that's on one piece. On the other hand, it's very rewarding because even though it looks like I can't tell what's going on with the kid, that's what your pediatric training is for. After a while, it becomes a second nature. It becomes almost like reflexes, right? So you can look at a kid, the kid is really crying, really upset, has a high fever, all that stuff, and in 10 minutes you can figure out, it's an ear infection or it's appendicitis. Please, we're calling 911. Kid has to go to the ER right now, or this kid is really crying, but they're fine. They're just having a tantrum. After a while, it becomes a reflex. So it's really cool because nobody knows what's wrong with the kid, but you know.
So this is an extra sense that you pick up as you interact with thousands and thousands of kids. You kind of can get a general sense about what is going on, even though you can't communicate with them directly, through talking, essentially.
Exactly.
Do you think you're also taking care of the parents as well?
Absolutely. It's a combo deal. Right? Because if you think about it, it doesn't take much to throw a parent off, right? A kid has a cold, so it's not complicated. They have a cold, but they have a fever, and mom and dad were up all night, and mom has missed her second day at work, and she's trying everything, and it's not going away. And maybe she went to the ER and saw somebody who was not sympathetic, and I'm not saying ER docs are not sympathetic. Okay, maybe they're having a bad day, maybe they're doing a code, and they tell mom, it's just a cold, nothing is wrong with your child. And the mom's like, what in the world? I've been through 2 bottles of Motrin. My kid is not sleeping at night. I'm not sleeping at night. I can't go to work. Everybody's miserable. There is something wrong. Fix it. Right? So pediatrics comes with taking care of the parent as well.
Okay. If you were back in medical school in your first few years, what would you do differently knowing that you weren't going to go into OBGYN, but you were going to do pediatrics?
Maybe not necessarily different, but maybe I'd have just gotten a lot more hands-on in pediatrics while I was there. So just a lot more, because the thing with the skills that we develop, the more hours you put into it, the more hands-on you get, the more second nature it becomes, the more of a reflex it is. And that's what you really want to be as a physician. You want to have reflexes, because when things show up, if a patient suddenly seizes in your office or whatever, you're not going to go to book. You're not going to have time to sit and recall. It's all down to your reflexes. So I'd probably spend more time touching more kids and getting more exams going and all of that stuff.
So as a medical student, you should try to get as many rotations in pediatrics as you can get your hands on before you apply for your residency.
Correct. As many as you can get. And it doesn't mean only because, a history is a history is a history. So even if you're doing another rotation at ENT and all that stuff, your kids are going to have ENT issues, right? They're going to have GI issues. They're going to have all of that. So even with your other rotations, you don't want to treat those like stepchild rotations, right? You still want to get as much hands-on. The beauty about being a medical student, which medical students won't necessarily agree with, is you get to have so many experiences. You get to get a lot of hands-on. You get to do all these things. And a time is coming when you won't, right? So I'm in private practice. I'm not following anybody around. I'm not seeing anybody who's telling me, hey, come look at this cute rash. Don't tell the parents we call it cute rash, but nobody's telling you those kind of things, because now you're still going to do some learning, but you don't have as many opportunities. As a medical student, you have a lot of opportunities.
So your academic years are very important in terms of getting over that learning curve, and
Yes.
you should embrace it instead of trying to race to the finish line.
Exactly. Because it will come to an end.
Is there a type of personality that you think is best suited for pediatrics?
Definitely has to be somebody who is patient, because a lot of pediatrics is education, right? A lot of our illnesses are viral, and you're going to have to look at a parent and tell them it's viral. We don't have any magic wand to make this go away. So you have to be that kind of person who's patient. You have to be that kind of person who loves to educate parents, because a lot of pediatrics is education. It's not very, for general pediatrics, it's not very procedure heavy, right? If it's a cold, it's going to go away. If it's diarrhea, it's going to go away. If it's a rash because it's dry skin, put some lotion on, it's going to go away. It's a lot of that stuff. But you have to explain to the patients well enough that they're okay with that, right? Because they always want to do something. And for the times that where the healthcare space is, I think regardless of specialty, you have to be someone who is flexible, who is willing to learn new things. So, back in the day when I graduated from residency, urgent care wasn't really a thing. Retail clinics were not really a thing. Telemedicine was not really a thing. Like, they just weren't there. So if you stay to same old, we'll do it the way it's always been done, then that's going to be a big problem, because things change. So you have to be willing to keep up with the times, learn new things, delve into new things.
Could you take us through your residency training? What was that like? How many years is it? How intense was it?
It was intense, but it was great though. So it was.
I never heard anyone say it wasn't intense.
No, it's always intense. It's always intense. So it's 3 years. So I graduated in 2008. So it's 3 years, and it's 80-hour work weeks. And depending on the rotation you do, sometimes it's a little less intense, but it is always intense, except you're on vacation. So we had a number of rotations that were general pediatrics, and then we went through most of the subspecialties. So you get to work in the neonatal ICU, the pediatric ICU, then you do your ENT, cardiology, all of that. Usually the outpatient rotation is a little lighter. Your ICU rotations can be pretty brutal, but you'll survive, right? There are many, 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 many pediatricians alive, which is proof of concept. So with the ICU rotations, we easily did 30-hour calls, went to many deliveries. Oh my gosh, stayed up all night, how to intubate 500-gram babies. Yeah, it was pretty intense, but it's a great experience. So the thing about it is, the way I look at it, it has a beginning, it has an end. I need to suck it up till the end. But with all those hours and all that time you spend in the hospital, and all those calls, what you end up leaving with is enough skill to handle whatever situation shows up.
And competence.
The last thing you want to do is be an attending who doesn't know anything. Right? Because then the buck stops with you.
Of course.
Yeah. So it's intense, but it's worth it. I wouldn't trade it for anything.
So what are the options when you get to the end of your training? Are there fellowships that people could potentially consider,
Yes.
or can you go out and start practicing?
So there are many different options, and it all depends on what you choose to do or how life takes you. So you can do general pediatrics, so in which case you can come out, start practicing, or open your practice or anything like that. And there are a ton of specialties. So, peds emergency medicine, you can do that. Gastroenterology, peds ENT, peds ENT, you have to go through ENT, peds dermatology, infectious disease, pulmonology, child abuse. There are tons and tons of rotations. And most of the time you end up going through all of these rotations so you can make a decision as to what you do. I do tell people, if you're going to look into subspecialties, don't just go based off a rotation that you liked. You also want to talk to people who are practicing in that field. So you get your before and after, you can make your judgment call based on that.
That's why we're doing this interview, so people get a perspective of the options that exist out there.
Yeah.
So if you choose the route of not pursuing a fellowship, do you have the option of working in the hospital, working for a private practice, a larger group? Can you start your own private practice? What are the options that exist for someone who's finishing and completing their training?
So for someone who doesn't want to do a fellowship, you can end up working in the hospital if you're working for, say, a pediatric outpatient group in a hospital. That's one choice. Some people will work in the private sector completely. That's one choice. As of right now, as a pediatrician, you can do pediatric urgent care, right? And that could be an urgent care setting or an urgent care within a hospital. There are urgent care fellowships coming up, so that may change as the years go on. But for right now, that's still an option. A lot of people will start their own practices. Very few people will start their practices right out of residency. Most people would work for someone else for at least a year or two, most people longer. And then they can start their own practice. But I have met people who started right out of residency, but they do tend to be entrepreneurial.
Now, do you see a mix of women and men in pediatrics?
Yes, but it's more women. Yeah, but it's more women.
Do you think it's becoming more equally balanced, or is that the trend? The trend is that there will continue to be always more women in the field.
Well, I don't know if I could speak to a trend going forward. It might stay the same. It's pretty much been that way for a while. I don't know what would make it change all of a sudden. Yeah.
Okay, so what would you say?
But it's not a women's specialty, though. That's for sure.
It's not a women's specialty, even though there are so many women.
There are, but it's not a women's specialty. There are a lot of men.
So what do the hours look like as an attending? Are you still doing 80 hours?
Well, absolutely not. But again, the hours will depend on, the specialty that you choose. So for instance, I do outpatient pediatrics in a private practice setting. So I don't do any overnights. I don't do any weekends. And I really don't do 5 days either. But that's my schedule, and I am 10 years out anyway. But, so that's my schedule. I have, my sister works in the urgent care setting, in the emergency room of a hospital. So she probably works about 40-hour weeks, but she still does overnights because, emergency rooms will be open 24/7. So somebody has to cover overnight shifts, right? So it tends to be a lot less hours, probably looking at 40 to 55 thereabout. But everything else depends on what you choose. Some people choose to work part-time. I have friends who are pediatricians who never worked full-time from the day they graduated. So you can choose to work part-time. You can choose to own your own practice, in which case you can decide how long you want to work.
So there's a nice lifestyle balance in terms of life and work balance.
There is, but you may have to look for it, right? So sometimes in a hospital setting, it may not be as free as it will be in a private practice setting. So you have to look for what you want, right? So if you decide, I really want to spend a lot of time with my family, I really want to work this aspect of my life, and I choose to work part-time, then you can choose to work part-time. So it really depends, but it's nothing like residency. Like it's a holiday compared to residency.
Are there new technologies or even telemedicine that are making pediatric medicine more fun, more enjoyable, more exciting to practice?
Well, yes. So there are some people who are doing telemedicine as their full-time job. So they would stay at home working kind of like how we are working now, right? Of course, they have to pick what diseases they can handle and all that kind of stuff. But yes, telemedicine is making a difference. A lot of people are going that route. For those who are not doing it full-time, they're doing hybrid. So like for my practice, telemedicine is an option. So we do both in office and telemedicine as well.
Dr. Uno, what would you say to a medical student or even a pre-med student interested in pediatrics? What would you do to inspire them to pursue a career in pediatrics?
Well, I would say go for it. Pediatrics is a pretty fun field. I love it. I would say get all the experience that you can. That medical school can be tough. Residency can be tough, but you end up better for it. I will also say that you want to be the kind of person who embraces technology, because what you see as medicine, medical practice when you're a student will keep evolving. So you need to evolve along with it. And I also throw out that I do believe that, medical students also have to think, at least have an open mind when it comes to the entrepreneurial side of things, because, medicine is not just a business, but there is business in medicine. So when you have opportunities to learn those, don't go like, oh, I don't care about that. That's not medicine. I only care about patients. You want to care about both, because the more skills you have, the better you can serve your patients, the better you can support your parents. Pediatrics is a fun specialty.
And you're right. If you bring innovation to your practice, the care of your patients is going to be much more superior.
Correct.
Versus
Correct.
not incorporating new technologies and a new approach to taking care of patients.
Yeah, and even for the entrepreneurial side is the same thing. So I run my own practice. I owe my patients to make sure my practice is well run and it stays profitable, so I can stay open to take care of my patients, right? So if I don't look at the business side of things, then I'm also doing them a disservice, because no matter how good my service is, if I can't pay the bills, I can't take care of them. So, those, they're all part of the same thing. They're all about patient care.
And are you happy that you chose pediatrics and not OBGYN?
I am. The quality, well, for me, and I want to say this carefully because some people watch this and they want to be OBGYNs. For me, it fits the quality, it fits the kind of lifestyle I want, right? I don't want to be attending labors and, deliveries at 2 a.m. when I'm 50. It's not my, I don't want to do that.
But some people do, and some people are excited about that. But essentially what you're saying is pick the profession that fits the lifestyle you want to live, and pick a profession where you get to interact with the types of patients you want to interact with.
Absolutely.
Okay.
So I'm glad I picked pediatrics. I wouldn't trade it for anything.
Dr. Una, thank you so much. You
My
are an inspiration for future pediatricians, so thank you.
My pleasure. Thanks for having me.